So good morning. I am Mr. Javerick B. Amis. So I am from Iligan Medical Center College. For now, I'll be preparing and administering for the medications, which is the oral and parenteral medications for the patient. So now, first, I'm going to introduce to you on what to prepare for the administering for the oral medications. So first, I have here a cups. I have here a cups, 3 pieces here, and then medication tray here, and then a glass with juice or water if any of this if you have. So I just here glass of water, a paper towel here or a tissue, and then liquid medicine in a bottle. So I have here the salbutamol asthma care syrup, and then the single pack tablet or capsule I have here, which is the ciprofloxacin or Ciprobay 500 milligram, and I have the tablets or capsules in a stock container here, the ascorbic acid, which is 500 milligram. So now let's proceed to first to preparing and administering the oral medications. So first, you need to check accuracy and completeness of each medicine ticket with doctor's order sheet. So I have here the doctor's order sheet, the medicine ticket rather. So I have here already, and also check patient's name, the medication and dosage and route and time of administration. So you need to check those patient's name, the medication here in the doctor's order sheet. And then for the reason is we need to ensure the patient receives correct medication and to avoid medication error. And also eligible MARs are a source of medication error. That's what I've mentioned earlier. And the next is you need to review pertinent information related to medication, which are the action, the purpose, the normal dose, and route, so side effects and nursing considerations from your patients. It is because the reason why is we need to allows us to anticipate the effects of the drug and observe the patient's response. So next is you need to assess for any contraindications to patient receiving oral medication. So the reason why we need this for the oral medication is we need to the alterations can interfere with medication distribution and also the absorption and excretion for the medicine. Next is we need to prepare the medications. So before preparing the medications for the oral for this medication, which is the oral, is you need to perform the hand hygiene first. In order for you to reduces transfer of microorganisms. And after performing the hand hygiene is arrange medication cups in medication preparation area. So you need to arrange well the medication cups here in the table and the tray. For the reason is for we to organize or the organization of equipments saves time and medical error. So next is to prepare medication for one patient at a time. So follow the 10 rights of medication administration, which are those the right patient, right drug, and then what else, so on and so forth. So we need to for the reason is we need to prevent distractions and limit preparation errors. So next is we need to check the correct medication from stock supply. So you as a nurse, you need to check the medication, the correct medication. Okay. So you need to read the labels, and comparing them with transcribed order reduces or error. So it is really necessary for us nurses to check the medications from the stock supply to your station for to avoid medications error. And next is you need to check the expiration date on each medication one at a time. So far, the expirations on the medicine that I have here is okay and good. There's still another year for the expiration. The reason is we need the medications past their expiration date may lose strength, be inactive, or harm the patient. So you need to be active or be use your initiative to know or to be to know the expiration date of the medicine that you've been given to your patients. So next, for the oral medication is you need to check or calculate medication dose as a necessary or double check calculation. So if ever your doctor's given you a medicine for your patient, so you need to double check it. You need to double check to reduce error. And the next is you need to prepare solid form or oral medication. First is you need to prepare tablets or capsules from a floor stock bottle. So you have here. Par liquid number into bottle cup and transfer medication to medication cup. So do not touch medication with fingers. Return extra tablets or capsules to bottle. So to avoid, the reason is to avoid contamination and waste of medication. So next is to prepare anti-dose tablets or capsules. Place package tablet or capsule directly into medicine cup. So do not remove wrapper. So now I have here the ciprofloxacin or Ciprobay, which is 500 milligram. Here. So wrapper maintains cleanliness. So before in opening is you need to face the label in front. So just like this in opening, just like that. Okay. So wrapper maintains cleanliness and allows you to identify medication name and dose at patient bedside. So next in to prepare liquids. First is gently shake the container. So I have here the liquid medicine, which is the salbutamol asthma care syrup. So in shaking, it's just like this. Shaking the container ensures that medication is mixed before administration. And next is to remove the bottle cap from container and place cap upside down. Hold a multi-dose bottle with label against palm. So here, against palm. My bottle is too small. Okay, just like this. And then palm of hand while pouring. So by opening the bottle cap or the medicine bottle is using the this point finger. To maintain cleanliness and ensure spilled liquid does not soil or fade the label. So here. Place medication cup at eye level on a hard surface. Eye level. So fill to this desired level on scale. Make sure that the scale is even with fluid level at its surface or base of meniscus or not edges. So this is to ensure that the accuracy of measurement is good and no other eye level. So you need to do the eye level for pouring the liquid medicine and transferring to the cup. So I have here the 10 ml. So before turning back the cap of the bottles, you need to wipe the medication bottle with a paper towel or tissue before covering with the bottle cap, to prevent bottle cap from sticking. Okay, and then throw it in the waste receptacles. So return stock containers to shelf. So I'm going to return now the cap to the bottle. So I have here the ascorbic acid. So you need to return after transferring the medicine to the cup. Return the stock containers to shelf or drawer and read label again. So the ciprofloxacin, ciprobate, okay, and then the ascorbic acid 500 milligram, the salbutamol asthma care syrup. So I have here already. So, in reading label of medications in multi-dose containers reduces administration error. So, next is do not leave medications unattended. So, always remember that as a nurse, you're not going to leave the medications unattended into the table. So, nurse is responsible for safekeeping of drugs. And the next is before going to patient's room, you need to compare patient's name and name of medication and label if prepared drugs with the medicine ticket. So you need to check first the name of your patient. If the medicine that you've been preparing for the medication is correct for the patients that you're going to give. Yes, it's okay. So it's good. And reading labels at the second time reduces errors. So you need to read it always to avoid medication errors. And also take medications to patient at correct time to ensure its intended therapeutic effect and complies with professional standards. So next is you need to ask the patient that his or her name or identify patient using a name tag. So which common of the common name tags that put it in the patient is in the hands. So here, there's a name tag in here. So compare with information on patient's medicine ticket. So you need to remember always that you as a nurse, you need to read the name first of your patient to your paper. And then for the distribution of the medication or administering medication, and to ensure it's correct patient. And also next is to explain purpose of each medication, its action, and possible side effects to patient. Because it allows patient to express concerns regarding possible non-adherence to therapy and possible identifies potential errors in medication orders. So after that, you need to perform necessary pre-administration assessments. So these pre-administration assessments is to determine whether specific administration should be withheld at the time. So next is we need to help patient to sitting or folder's position. So use side lying position. If sitting is contraindicated, have patient stay in this position for 30 minutes after administration. So the reason is to need to prevent aspiration during swallowing. And the next is administer medications. Allow patient to hold solid medications in hand or cup before placing in mouth. So the reason is the patient becomes familiar with medications by seeing each drug. And then next is to offer water or juice to help patients swallow and give full glass if not indicated. So I have here the water. And then choice of fluid can improve fluid intake. And next is to stay until patient completely takes all medications by their prescribed route. And then ask your patient to open their mouth if uncertain whether medication was swallowed. But if the patient cannot open their mouth on their own, so you as a nurse, you need to assist them. And then the reason is to ensure that patient receives ordered dosage. And the next is help your patient return to comfortable position. So if your patient's position in the lying before you repositioning it, you need to return your patient into comfortable position, which the original position or that your patient has before. So to maintain patient comfort. And the next is perform hand hygiene to reduce transmission of microorganisms. So I have here the alcohol to remove the microorganisms. Next is to evaluate patient's response to medications. So in evaluating patient's response for medications is to evaluate therapeutic benefit of medication and detects onset of side effects or allergic reactions. So after evaluating patient's response is you need to chart medication dose, route and time and date given and the patient's medication or record immediately after administering. So the reason of this chart medication for the patient's order for medication is to ensure that you have given the patient the medication or the right medication. So next is you need to write down here. I have here already the medicine ticket and the medication sheet transferred.